Coronavirus. What happens to people's lungs if they get COVID-19?
冠状病毒，如果人们感染了
COVID-19.
他们的肺会发生什么？
Graham read for 10-12 minutes what became known as COVID-19, or the coronavirus, started in late 2019 as a cluster of pneumonia cases with an unknown cause. The cause of the pneumonia was found to be a new virus, severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. The illness caused by the virus is COVID-19.
这种被称为
COVID-19.
的病毒，或称为冠状病毒，始于2019年末，是一群原因不明的肺炎病例。肺炎的原因被发现是一种新的病毒，严重急性呼吸综合症冠状病毒2，或
SARS-CoV-2.
这种病毒引起的疾病是
COVID-19. Now declared as a pandemic by the World Health Organization (WHO), the majority of people who contract COVID-19 suffer only mild, cold-like symptoms.
现在世界卫生组织
WHO
宣布大流行，大多数感染
COVID-19.
的人只有轻微的感冒症状。
WHO says about 80% of people with COVID-19 recover without needing any specialist treatment. Only about 1 person in 6 becomes seriously ill and develops difficulty breathing.
世卫组织说，大约80%的
COVID-19.
患者在不需要任何专家治疗的情况下康复。大约每6个人中只有1个人病情严重，并出现呼吸困难。
So how can COVID-19 develop into a more serious illness featuring pneumonia, and what does that do to our lungs and the rest of our body?
那么
COVID-19.
是如何发展成以肺炎为特征的更严重的疾病的呢？这对我们的肺和身体的其他部分有什么影响呢？
How is the virus affecting people?
病毒是如何影响人类的？
Guardian Australia spoke with Professor John Wilson, President-elect of the Royal Australasian College of Physicians and a respiratory physician.
卫报澳大利亚采访了约翰·威尔逊教授，他是澳大利亚皇家内科医学院的当选院长，也是一名呼吸科医生。
He says almost all serious consequences of COVID-19 feature pneumonia.
他说，几乎所有严重的后果，因为
COVID-19.
特征性肺炎。
Wilson says people who catch COVID-19 can be placed into 4 broad categories.
威尔逊说，感染
COVID-19.
的人可以分为4大类。
The least serious are those people who are subclinical and who have the virus but have no symptoms.
最不严重的是那些亚临床的人，他们有病毒但没有症状。
Next are those who get an infection in the upper respiratory tract, which, Wilson says, means a person has a fever and a cough and maybe milder symptoms like headache or conjunctivitis.
接下来是那些在呼吸道上部感染的人。
Wilson
说，这意味着一个人有发烧和咳嗽，也许还有轻微的症状，如头痛或结膜炎。
He says, those people with minor symptoms are still able to transmit the virus but may not be aware of it.
他说，那些有轻微症状的人仍然能够传播病毒，但可能没有意识到。
The largest group of those who would be positive for COVID-19, and the people most likely to present to hospitals and surgeries, are those who develop the same flu-like symptoms that would usually keep them off work.
对
COVID-19.
呈阳性反应的最大群体，以及最有可能出现在医院和外科手术中的人群，是那些出现通常会让他们无法工作的类似流感症状的人群。
A 4th group, Wilson says, will develop severe illness that features pneumonia.
第4组，威尔逊说，将发展成以肺炎为特征的严重疾病。
He says, in Wuhan, it worked out that from those who had tested positive and had sought medical help, roughly 6% had a severe illness.
他说，在武汉，调查结果显示，那些检测呈阳性并寻求医疗帮助的人中， 大约有6%患有严重疾病。
The WHO says the elderly and people with underlying problems like high blood pressure, heart and lung problems or diabetes are more likely to develop serious illness.
世界卫生组织说，老年人和有潜在问题的人，如高血压、心脏和肺部问题或糖尿病，更有可能发展成严重的疾病。
How does the pneumonia develop?
肺炎是如何发展的？
When people with COVID-19 develop a cough and fever, Wilson says this is a result of the infection reaching the respiratory tree, the air passages that conduct air between the lungs and the outside.
当患有
COVID-19
的人出现咳嗽和发烧时，威尔逊说这是感染到呼吸束的结果。呼吸束是在肺部和外部之间传输空气的通道。
He says, the lining of the respiratory tree becomes injured, causing inflammation. This in turn irritates the nerves in the lining of the airway. Just a speck of dust can stimulate a cough.
他说，呼吸束的内层受到损伤，引起炎症。这反过来刺激气道内壁的神经，一粒灰尘就能引起咳嗽。
But if this gets worse, it goes past just the lining of the airway and goes to the gas exchange units, which are at the end of the air passages.
但是，如果情况变得更糟，它就会越过气道内壁，进入气体交换单元。这个单元位于气道的末端。
If they become infected, they respond by pouring out inflammatory material into the air sacs that are at the bottom of our lungs.
如果它们被感染，它们的反应是将炎症物质倾倒到我们肺底的气囊中。
If the air sacs then become inflamed, Wilson says this causes an outpouring of inflammatory material fluid and inflammatory cells into the lungs and we end up with pneumonia.
威尔逊说，如果气囊发炎，就会导致炎症物质、液体和炎症细胞涌入肺部，最终导致肺炎。
He says lungs that become filled with inflammatory material are unable to get enough oxygen to the bloodstream, reducing the body's ability to take on oxygen and get rid of carbon dioxide.
他说，充满炎症物质的肺部无法向血液中输送足够的氧气，降低了身体吸收氧气和排除二氧化碳的能力。
That's the usual cause of death with severe pneumonia, he says.
这是严重肺炎的常见死因。他说
How can the pneumonia be treated?
肺炎怎样治疗？
Professor Christine Jenkins, chair of Lung Foundation Australia and a leading respiratory physician, told Guardian Australia, Unfortunately, so far we don't have anything that can stop people getting COVID-19 pneumonia.
澳大利亚肺脏基金会主席、主要的呼吸科医生克里斯汀·詹金斯教授告诉《卫报》澳大利亚版，不幸的是，到目前为止，我们还没有任何东西可以阻止人们得
COVID-19
肺炎。
People are already trialing all sorts of medications and we're hopeful that we might discover that there are various combinations of viral and antiviral medications that could be effective. At the moment there isn't any established treatment apart from supportive treatment, which is what we give people in intensive care.
人们已经在尝试各种药物。我们希望我们可能会发现病毒和抗病毒药物的各种组合可能是有效的。目前，除了支持性治疗外，还没有任何固定的治疗方法。我们给重症监护病人提供这种治疗方法。
We ventilate them and maintain high oxygen levels until their lungs are able to function in a normal way again as they recover.
我们给他们换气，保持高氧水平，直到他们的肺部恢复正常功能。
Wilson says patients with viral pneumonia are also at risk of developing secondary infections, so they would also be treated with antiviral medication and antibiotics.
威尔逊说，病毒性肺炎患者也有发展为继发感染的危险，因此他们也将接受抗病毒药物和抗生素的治疗。
In some situations that isn't enough, he says of the current outbreak, The pneumonia went unabated and the patients did not survive.
在某些情况下，这是不够的。他说，目前的疫情爆发，肺炎有增无减，病人无法存活。
Is COVID-19 pneumonia different? COVID-19.
肺炎不同吗？
Jenkins says COVID-19 pneumonia is different from the most common cases that people are admitted to hospitals for.
詹金斯说，
COVID-19.
肺炎不同于最常见的人们入院治疗的病例。
Most types of pneumonia that we know of and that we admit people to hospital for are bacterial and they respond to an antibiotic.
据我们所知，大多数类型的肺炎都是细菌性的，需要住院治疗，并且对抗生素有反应。
Wilson says there is evidence that pneumonia caused by COVID-19 may be particularly severe. Wilson says cases of coronavirus pneumonia tend to affect all of the lungs, instead of just small parts.
威尔逊说，有证据表明，由
COVID-19
引起的肺炎可能特别严重。威尔逊说，冠状病毒肺炎的病例往往影响所有的肺部，而不仅仅是小部分。
He says, once we have an infection in the lung and, if it involves the air sacs, then the body's response is first to try and destroy the virus and limit its replication.
他说，一旦我们在肺部感染，如果涉及到气囊，那么身体的反应首先是试图摧毁病毒，并限制其复制。
But Wilson says this first responder mechanism can be impaired in some groups, including people with underlying heart and lung conditions, diabetes and the elderly.
但威尔逊说，这种第一反应机制可能在某些群体中受到损害，包括有潜在心肺疾病、糖尿病和老年人。
Jenkins says that, generally, people aged 65 and over are at risk of getting pneumonia, as well as people with medical conditions such as diabetes, cancer or a chronic disease affecting the lungs, heart, kidney or liver, smokers, Indigenous Australians, and infants aged 12 months and under.
说，一般来说，65岁及以上的人有患肺炎的风险，还有那些患有糖尿病、癌症或影响肺、心脏、肾脏或肝脏的慢性疾病的人、吸烟者、澳洲原住民，以及12个月及以下的婴儿。
Age is the major predictor of risk of death from pneumonia. Pneumonia is always serious for an older person and in fact it used to be one of the main causes of death in the elderly. Now we have very good treatments for pneumonia.
年龄是肺炎死亡风险的主要预测因素。肺炎对老年人来说总是严重的。事实上，它曾经是老年人死亡的主要原因之一。现在我们有很好的治疗肺炎的方法。
It's important to remember that no matter how healthy and active you are, your risk for getting pneumonia increases with age. This is because our immune system naturally weakens with age, making it harder for our bodies to fight off infections and diseases.
重要的是要记住，无论你多么健康和活跃，你患肺炎的风险随着年龄的增加而增加。这是因为随着年龄的增长，我们的免疫系统会自然而然地减弱，使我们的身体更难抵抗感染和疾病。